Dysmenorrhea, which means painful menstruation of sufficient magnitude so as to incapacitate the day-to-day activities. It is so severe in intensity that inhibit women to perform her routine work. Now let's see the types of dysmenorrhea. It may be primary or secondary. If we say the primary dysmenorrhea, there is no pelvic pathology present, and that is of two types, membranous and spasmodic. Now let's discuss the etiology of primary dysmenorrhea. It is usually seen in adolescent age and confined to ovulatory cycles, associated with dysrhythmic uterine contractions and uterine hypoxia. Psychosomatic factors: uterine myometrial hyperactivity, junctional zone hyperplasia, and overactivity of sympathetic nerves, which will lead to hypotonicity of junctional zone. Junctional zone is the inner third layer of myometrium which is in contact with endometrium. Prostaglandins like PGF2 alpha and PGE2 are strong vasoconstrictor and causes ischemia. Vasopressin, endothelin and platelet activating factors induces pain. Now let's discuss the clinical features of primary dysmenorrhea. It appears within 2 years of menarche and begins few hours before or with menses. There will be lower abdominal pain which radiates to back and thighs. There will be systemic discomfort like nausea, vomiting, fatigue, headache and tachycardia, and rarely it leads to syncope and collapse. In treatment, psychotherapy, bowels should be kept empty, analgesics and antispasmodic, prostaglandin synthesis inhibitors, non-steroidal anti-inflammatory drugs which inhibit cyclooxygenase 1 and 2. In surgical part, presacral neurectomy and dilatation of cervical canal can be done. The secondary dysmenorrhea, where there is presence of some pelvic pathology. Etiology: cervical stenosis, pelvic endometriosis, pelvic adhesions, adenomyosis, uterine fibroid, endometrial polyp, and chronic pelvic infection. Now let's see the clinical features of secondary dysmenorrhea. Dull pain without radiation 3 to 5 days prior to menses. There will be no systemic discomfort and associated symptoms of pelvic pathology will be present. Here we need to treat the cause.